Welcome to the deep dive. Today we're tackling, well, a really itchy subject for a lot of pet owners. Flea bite hypersensitivity, FBH.
That's right. And it's more than just, a simple flea bite. We're talking about a genuine allergic reaction some animals have. It's quite intense.
Exactly. So we've been looking into expert veterinary guidance on this. We really want to understand what FBH is, how it's different from, say, just a regular flea problem.
And crucially, what can actually be done about it.
Yeah, what works. Our mission for this deep dive is basically to get clear on FBH and offer some practical insights if, you're facing this.
Okay.
So let's start at the beginning. Who's the main culprit here?
Well, the primary troublemaker is usually the cat flea. Tennicephalides felis, if you want the scientific name.
Cat flea. But it affects dogs, too.
Oh, absolutely. Don't let the name fool you. They're definitely not picky.
Yeah.
Dogs, cats, various wildlife. They're happy to feed on all of them.
And they're pretty prolific breeders, I gather.
Extremely. A single adult female flea can lay, get this, up to 50 eggs every single day.
50 a day. Wow. And where do those eggs end up? Not just on the pet, right?
No, that's the key. They're not sticky. They just roll right off your pet and land in the environment.
So carpets, sofas.
Exactly. Carpets, upholstery, pet bedding, cracks in the floorboards, under furniture, anywhere the pet spends time.
Okay. And then they hatch into larvae.
Yes. And the larvae have this interesting behavior called negative phototropism,
Name.
meaning they hate light, so they actively move away from it, burrowing deeper into carpets or under things.
Like tiny little vampires hiding in the shag carpet.
Sort of, yeah. They want dark, protected places. They can also survive outdoors in moist, shaded areas under decks and bushes, that sort of thing.
So the problem isn't just indoors.
Not always, no. After the larval stage, they spin a cocoon and become pupa.
Oh.
This cocoon is incredibly resilient. It protects them.
Protects them from what? Insecticides?
It can, yes. And from drying out. They can stay dormant in that stage for quite a while, waiting for the right signal.
Which is the pet walking by.
Pretty much. Vibrations, heat, carbon dioxide from a host passing by triggers them to hatch into adult fleas almost instantly and jump on.
Okay, this is building a picture, but here's the statistic that really stood out to me. Less than 5% of the total flea population is actually on the pet.
That's absolutely right. It's a crucial point. The vast majority, like 95% or more, exist in the environment as eggs, larvae, and pupa. The biomass of the infestation is in your house, not on your dog or cat.
That really changes things. You think you're just fighting the fleas you see, but that's just the tip of the iceberg.
Precisely. And understanding that environmental load is fundamental to getting control.
Okay. So let's shift to the reaction itself. Why do some animals get this hypersensitivity, this FBH? It's not just irritation, you said.
No, it's a true allergy. It's an allergic reaction specifically to antigens proteins, essentially found in the flea's saliva.
So it's the flea spit, basically.
Yeah. Basically, yes. There's a low molecular weight substance called a hapten, and also a couple of larger allergens in the saliva. The immune system of sensitive animals just goes haywire when exposed to them.
How does that work? What's the process?
Well, these salivary proteins, they seem to bind quite effectively to components in the animal skin, like dermal collagen. This binding makes them look like a bigger threat to the immune system.
Ah, so the skin itself almost helps flag it for the immune system.
In a way, yes. Plus, the saliva also contains histamine-like compounds, which cause direct irritation and itching, even without the allergic part. So it's kind of a double hit.
Direct irritation and an over-the-top immune response.
Got it. Now, I read something counterintuitive, that pets exposed infrequently are more likely to develop FBH than pets constantly crawling with fleas. How does that make sense?
It does sound odd, doesn't it? But it seems that intermittent exposure might be more likely to sensitize the immune system. Constant exposure might, in some cases, lead to a degree of immune tolerance, though you certainly wouldn't want that. So like poking a sleeping bear occasionally versus living with it.
Maybe not the best analogy, but it captures the idea that the immune system doesn't get used to it with sporadic bites. It stays on high alert or even ramps up its reaction. We see involvement from different parts of the immune system, things called IgE and IgG antibodies.
Okay.
This leads to both immediate hypersensitivity, itching right away, and also delayed reactions that can pop up hours later. There's even a late phase of response involving specific inflammatory cells rushing to the site.
It sounds exhausting and just miserable for the animal.
It really is. Constant severe itching.
So what are the signs? If you're a pet owner, what should make you suspect FBH beyond just seeing fleas?
The number one sign is intense pruritus. That's the clinical term for itching. You'll see Excessive chewing, licking, scratching, rubbing against things.
Any particular spots they focus on?
Yes, the distribution is often quite characteristic, though it varies a bit. In dogs, look for trouble. Mostly on the back half, the lower back near the tail base, the rump, the back and insides of the thighs, the lower abdomen, the groin area.
Okay, the flea triangle area sometimes?
Exactly. Initially, you might just see little red bumps, papules, but because of the intense scratching and chewing, you quickly get secondary problems.
Like what?
Hair loss, obviously. Skin thickening, what we call lichenification, darkening of the skin, hyperpigmentation, scaling, and those awful, raw, weeping sores, often called hot spots or pyotraumatic dermatitis.
Oh, hot spots look so painful.
Yeah.
What about pats? Is it the same pattern?
Similar locations sometimes, but cats often show different signs too. You might see hair loss and crusty, scabby dermatitis in a sort of wedge shape over their lower back. But very commonly, cats with FBH have issues around the head and neck as well. Lots of scratching there.
Head, neck too, okay.
You might also see barbering, where they lick so much, usually on their belly or inner thighs, that the fur looks like it's been shaved clean off.
Wow.
Another classic sign in cats is miliary dermatitis. It feels like tiny little scabs or bumps all over their body, almost like millet seeds under the skin. And sometimes they develop lesions belonging to the eosinophilic granuloma complex, which is a whole other set of inflammatory reactions.
So it can look quite different between dogs and cats, and even between individuals.
That way.
Which must make diagnosis tricky sometimes. How does a vet figure out if it's definitely FBH?
It's often a combination of factors. The patient's history is key. The intense itching, maybe known exposure to fleas or other animals, sometimes a history of inconsistent flea control.
Right.
Then there's the physical exam, looking for those characteristic lesion patterns we just talked about. Finding actual fleas or flea dirt is, of course, very supportive.
But you said sometimes you don't find them.
Exactly. Especially with cats or any really fastidious groomer. A highly allergic pet might be so itchy that they groom away all the evidence before you even see it. So absence of fleas doesn't rule out FBH.
That's important. What else can help? I think I saw something about tapeworms.
Yes. Fleas are intermediate hosts for a common tapeworm, Diploidium caninum. If a pet swallows an infected flea while grooming, they get tapeworms. So finding tapeworm segments, they look like little grains of rice in the stool or around the anus, is indirect evidence of flea exposure.
Interesting clue. Are there specific allergy tests?
There are blood tests, RAST and ELISA, that look for IgE antibodies against flea saliva. But honestly, their accuracy is variable. You can get false positives or false negatives.
So not totally reliable.
Not definitively, no. Intradermal allergy testing, where tiny amounts of flea antigen are injected into the skin, can be more informative. We look for an immediate wheal and flare reaction, and sometimes a delayed reaction hours later.
Okay.
But frankly, the most reliable diagnostic test is often the response to treatment. If you implement really strict, effective flea control, and the itching resolves, that's very strong evidence for FBH.
So the proof is in the pudding, or the lack of itching?
Pretty much. We can also take skin biopsies, look at them under a microscope. We might see patterns like superficial paravascular dermatitis with eosinophils, maybe little eosinophilic microabscesses. But these findings aren't absolutely specific to FBH. Other allergies can sometimes look similar pathologically.
Right. It's putting all the clues together. Okay, let's get to the really crucial part. Treatment. You mentioned there's no cure.
Unfortunately, no. It's an allergy, so the hypersensitivity remains. And some animals actually become more sensitive as they age. Allergy shots or hyposensitization, which we use for some environmental allergies, just don't work for FBH.
So management is key. What are the main goals?
Two main things. First, you have to relieve that awful itching to make the pet comfortable and break the itch-scratch cycle that damages the skin. Second, and this is the absolute cornerstone, you need rigorous, consistent flea control.
Let's talk about itch relief first. How do you calm that down quickly?
Corticosteroids, steroids, are usually the go-to for rapid relief. They're very effective anti-inflammatories. Vets might use an injectable form for a quick start, like triamcinolone or dexamethasone in dogs, or methylprednisolone acetate in cats.
And pills, too.
Yes, oral prednisolone or prednisone is very common for both dogs and cats. The vet will prescribe a tapering dose start higher to break the cycle, then gradually reduce to the lowest effective dose for the shortest possible time.
Because of potential side effects with long-term steroids?
Exactly. We want to use them strategically while getting the underlying flea problem sorted. It's also worth noting, standard antihistamines usually have very little effect on the intense itch of FBH.
Good to know. Don't bother with those, probably. Okay, steroids for the flare-up. But the real solution is flea control. This sounds like the main event.
It absolutely is. You need to kill the adult fleas currently on the pet, and you must break the flea life cycle in the environment to stop new fleas from developing.
Hmm?
Remember that 95%.
Right, the environmental load. So how do we tackle the fleas on the pet itself? What are the options?
Lots of effective options now. Topical spot-on products are very popular. You apply a small vial of liquid to the skin, usually between the shoulder blades.
What's in those?
Various active ingredients. Some common ones are combinations like dinotfuran plus pyroproxyfen, or fipronil plus an IGR, that's an insect growth regulator. Imidacloprid plus an IGR is another common one. Signalment, indoxacarb, there are several good choices.
You mentioned IGRs. What do they do again?
Right, IGRs like pyroproxyfen or S-methoprene mimic insect hormones. They prevent flea eggs from hatching or larvae from developing into adults. They break the life cycle.
Okay, that sounds vital.
It is. There are also insect development inhibitors, IDIs, like lufinuron, or sometimes selamectin has this effect too. They interfere with chitin synthesis, which fleas need for their exoskeleton and eggshells. Again, stops reproduction.
What about sprays for the pet?
Sprays containing pyrethrins, or synthetic pyrethroids, often with an IGR, can work. They provide a quick kill. But you need to ensure thorough coverage, which can be tricky, especially on long-haired pets. And cost per application might seem lower initially, but maybe not over time compared to monthly spot-ons.
And you have to be careful with ingredients, right? Especially for cats.
Extremely careful. This is critical. Products containing permethrin, a common pyrethroid, are highly toxic, potentially fatal to cats. Never, ever use a dog flea product on a cat unless it specifically says it's safe for both. And even then, read the label carefully.
Okay, huge warning there. What about oral medications? Pills?
Yes, several options there too. Nitropyrum gives a very fast kill of adult fleas, but it only lasts about 24 hours. Good for a quick clean out, maybe.
Like before surgery or something.
Exactly. Then there's Spinosad, a monthly chewable tablet, and the newer isoxazoline class drugs like afoxolaner, fluorolaner, serolaner, lotilaner. These give excellent, long-lasting protection, typically a month or even 3 months for fluorolaner.
3 months from one pill. Wow.
Yes, but currently those longer-acting ones are mostly licensed for dogs. Always check the species indication.
Okay, so lots of ways to treat the pet. But that's only 5% of the problem. What about the house? The other 95%.
Right, premises control. You need to tackle the eggs, larvae, and pupa in your home. Foggers or bombs can treat a whole room, but their penetration is often poor. They don't get under furniture well or deep into carpets where the larvae are hiding.
Oh, okay.
Handheld premise sprays containing an adulticide, like a pyrethroid plus an IGR, are often more effective because you can direct the spray into those key hiding spots under furniture, along baseboards, in closets, pet bedding areas. They also often have some residual activity.
So more targeted.
Yes. You need to treat the areas where the flea biomass is concentrated. Regular, thorough vacuuming is also really important. It physically removes some eggs and larvae, and the vibrations can stimulate pupa to hatch, making them vulnerable to insecticides. Just be sure to discard the vacuum bag immediately afterwards outside.
Good tip. What about professional exterminators?
Definitely an option, especially for severe infestations or if you just want to ensure it's done thoroughly. They have access to potent, long-lasting products.
Okay, indoors covered. What if fleas are coming from outside? The yard.
You want to treat the environment, focusing on those shaded, moist areas. Fleas love under porches, decks, bushes, and crawl spaces. Outdoor sprays often contain pyrethroids or older compounds like organophosphates, ideally with an IGR.
How do you apply those?
There are hose-end sprayers that mix the concentrate with water as you spray, or ready-to-use pump sprayers. Again, focus on likely flea habitats. If you know feral animals visit your yard, treating perimeter areas might be needed.
Any non-chemical options for the yard?
There are beneficial nematodes, specifically Steinernema carpocapsae. These microscopic worms attack flea larvae and pupae in the soil. They're safe for pets and people, but they can be expensive and require specific moisture conditions to work well, so maybe less reliable.
Okay, it really is a multi-pronged attack. Treat the pet, treat the house, treat the yard if necessary.
Absolutely. You need to hit all stages of the life cycle.
Now, using all these chemicals, are there any major precautions or things to watch out for besides the cat permethrin issue?
Always, always, always read and follow the product label instructions precisely. Dose correctly for the pet's weight. Apply as directed. Don't combine products unless your vet approves it.
What about specific drug interactions?
Well, there was a note about using Spinosad with high-dose ivermectin, sometimes used for mange, but it's considered safe with the standard low doses used in heartworm preventatives. Generally, modern flea products are very safe when used correctly.
Any other common adverse reactions?
Some pets can be sensitive to pyrethrin spirithroids. You might see drooling, tremors, lethargy. If that happens, bathe the pet with mild dick soap and call your vet. Organophosphates, found in some older products or premise sprays, have a narrower safety margin. We generally avoid them now due to safer alternatives. If accidental exposure occurs, bathing thoroughly is important.
What about older things like flea powders or dips?
Generally not recommended anymore. They're often less effective, messier, and have a higher potential for toxicity compared to modern spot-ons and orals.
And you mentioned being cautious with over-the-counter products.
Yes, mainly because they often come without professional advice. People might buy the wrong product, use it incorrectly, or, crucially, neglect the environmental treatment aspect, leading to failure and ongoing frustration. Getting advice from your vet ensures you have a comprehensive, appropriate plan.
That makes sense. So you've started the treatment plan. How do you monitor success? How do you know it's working?
The primary indicator is a decrease in the pet's itching. That's what you're aiming for. As we said, just not seeing fleas isn't always enough, especially in a highly sensitive pet where one bite can cause issues. You want the symptoms to resolve.
And how long do you need to keep treatment going?
For prevention, especially in warm climates, or if the home was infested, year-round flea control is strongly recommended. In colder areas with true winters, you can often stop during the deep freeze, but should restart promptly when temperatures consistently rise above freezing, usually in early spring.
Consistency is key.
Absolutely. A single lapse can allow the cycle to restart.
Are there complications if FBH isn't managed well, besides the itching?
Yes, the self-trauma can lead to nasty secondary bacterial skin infections, folliculitis. Those acute, moist dermatitis hotspots can get quite severe. And some animals develop chronic lick granulomas, which are thickened, raw areas from persistent licking, often on the legs or paws.
But if you are diligent with control, what's the outlook?
The prognosis is generally very good. If you maintain strict, consistent flea control on the pet and in the environment, you can keep the pet comfortable and prevent the signs of FBH.
That's really good news. It's manageable with the right approach.
Definitely.
Okay, so let's quickly recap this deep dive. Flea bite hypersensitivity, FBH, it's a specific allergic reaction to flea saliva, not just simple bites.
Right. And remember, the vast majority, like 95% of the flea population, isn't on your pet. It's hiding as eggs, larvae, and pupa in your home environment.
Which means effective treatment absolutely has to involve treating the pet and the premises and sometimes the yard. It needs that integrated approach.
Exactly. Combining itch relief, often with short-term steroids, and then long-term consistent use of appropriate flea control products targeting all life stages.
Yeah.
That's the path to success.
This has been super informative, and it really makes you think, doesn't it? If something as tiny as flea saliva can cause such a dramatic, complex immune reaction, what other seemingly minor things in our pet's environment could be triggering unexpected issues? How much more attuned do we need to be?
That's a really interesting thought. Definitely food for thought for all pet owners.
Indeed. Well, thank you for walking us through all that, and thanks everyone for joining us on the deep dive.